Good morning to all. Today we will discuss introduction to public health. The public health is the study and practice of managing threats to the health of a community. The goal of public health is to improve lives through the prevention or treatment of disease. Coming to the definition, public health dentistry is the science and art of preventing disease, prolonging life, and promoting physical and mental efficiency through organized community effort for the sanitation of the environment, the control of communicable diseases, the education of the individual in the personal hygiene, the organization of medical and nursing services for the early diagnosis and preventive treatment of disease, and the development of social machinery to ensure everyone a standard of living, advocate for the maintenance of health. So organizing these benefits as to enable every citizen to realize his birthright of health and longevity. Coming to the history of public health, the history of public health can be explained in three headings: miasma theory of disease, germ theory of disease, and modern public health. First is miasma theory of disease. Miasma means pollution. The miasmatic theory of disease began in the Middle Ages and continued to the middle of 1800s, when it was used to explain the spread of cholera in London and in Paris. This theory held that the disease such as cholera or Black Death were caused by miasma, considered to be a poisonous vapor or mist that is filled with particles from decomposed matters that could cause illness, and is identifiable by its nasty foul smell which came from the decomposed material. Next is the germ theory of disease. It is a theory that proposes that microorganisms are the cause of many diseases. Dr. John Snow contributed to the formation of germ theory when he traced the source of cholera outbreak in London. That is in 1854. Next is modern public health. Through 20th century, public health to put more focus on chronic diseases like cancer and health diseases. There is a recognition that the health is affected by many factors, including where the people live, genetics, income, educational status, and social relationships. These are known as social determinants of health. Coming to changing concept of health, we have four concepts of health. First one is biomedical concept, then ecological concept, psychosocial concept, and holistic concept. First is biomedical concept. This concept views health as the absence of disease. It is based on germ theory of disease. It doesn't consider other social, environmental, and cultural determinants of health. Next is ecological concept. This concept views health as a dynamic equilibrium between man and his environment, and disease is a maladjustment of the human organism to environment. Next is psychosocial concept. This concept reveals that health is not just a biomedical phenomenon, but is also influenced by social, psychological, cultural, economic, and political factors. Thus, health is considered both a biomedical and a social phenomenon. Now comes the last concept. It is holistic concept. It is the synthesis of all the above concepts and implies that all sectors of society has an effect on health. It recognizes the strength of social, economic, political, and environmental influence on health. So, combining all the four concepts, WHO made a definition for health, which says that health is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. Coming to the concept of causation, there are 7 concepts of causation: epidemiological triad, multifactorial causation, natural history of disease, web of causation, risk factors and risk groups, spectrum of disease, and iceberg of disease. First is epidemiological triad. The occurrence and manifestation of any disease is determined by the interaction between agent, host, and the environment. This is the basis of epidemiological triad. These three factors, that is the agent, host, and the environment, together constitute the epidemiological triad. The agent is the organism or a substance or a force, thus the presence or lack of which may initiate a disease process. The host is the man himself, and the environment is the source or reservoir for the agent of the disease, and it helps in the transmission of agent to the host. Next is multifactorial causation. The modern diseases of civilization like coronary heart disease and cancer could not be explained on the basis of single cause idea because they were due to multiple factors. So this is the basis of multifactorial causation. Next is natural history of disease. This model signifies the way in which a disease evolves over the time from the period of its earliest stage to its termination as recovery or death. It has two periods. First is the period of pre-pathogenesis and the period of pathogenesis. Next is web of causation. It is applicable in certain diseases, especially the chronic diseases where the causative agent may be unknown or uncertain, and the disease is the result of interaction of multiple factors. Removal of some of them or even one of them may be sufficient to control the disease. This is the pictorial representation of web of causation of dental caries. Next is risk factors and risk groups. Risk factors are an exposure that is significantly associated with the development of a disease. Risk groups are those who are exposed to risk factors. Next is spectrum of disease. It is a graphical representation of the sequence of events that occur in the human host from the time of contact with the etiological agent up to the point of the ultimate outcome, which can be fatal in extreme cases. This is the graphical representation of spectrum of disease. Next is iceberg of disease. The health professionals see only a small part of the illness in the community, just as only a small part of iceberg is visible above the surface of water. This is the representation of iceberg of dental caries. Here we can see the health professionals will be always concentrating on clinical diseases. The clinical diseases will be ignored by them. So that can cause a burden in the next coming years. Now, the changing concept in public health. The changing concepts in public health has 4 phases. Disease control phase, that is from 1880 to 1920. Health promotional phase, that is from 1920 to 1960. Social engineering phase, that is from 1960 to 1980. And health for all phase, that is from 1981 to 2000. First is disease control phase. During the 19th century, the disease control phase was a matter aimed at the control of man's physical environment, example water supply, sewage disposal, etc. These measures were not aimed at the control of any specific disease. However, these measures vastly improved the health of the people. It was largely a matter of sanitary legislation and sanitary reforms aimed at the control of man's physical environment. Next is health promotional phase. At the beginning of 20th century, a new concept, the concept of health promotion began to take shape. It was realized that public health had neglected the citizen as an individual. So to overcome this, in addition to disease control activities, one more goal was added to public health, that is health promotion of individuals. Two great movements were initiated for the human development during the first half of 20th century, namely the provision of basic health science through the medium of public health centers and sub-centers for the rural and urban areas. And the second great movement was the to promote village development through the active participation of the whole community and on the incision of the community. Next is social engineering phase. With the advance in the preventive medicine and the practice of public health, the pattern of disease began to change in the developed world. New health problems in the form of chronic diseases began to emerge. Example, cancer, diabetes, cardiovascular disease, alcoholism, etc. These diseases can't be explained using miasma theory or germ theory. A new factor called a risk factor as determinant of these diseases came into existence. Social and behavioral aspect of the health were given a new priority. Now comes the health for all phase. On 12th September 1978, the joint WHO-UNICEF International Conference at Alma-Ata called for acceptance of WHO goal of health for all by 2000 AD and proclaimed primary healthcare as a way to achieve health for all. Coming to primary healthcare. The concept of primary healthcare came into existence following a joint WHO-UNICEF International Conference at Alma-Ata, USSR on 12th September 1978. The conference proclaimed primary health care as a way to achieve health for all. Coming to the definition, primary healthcare is defined as the essential healthcare based on practical, scientifically sound, and socially acceptable methods and technology made universally acceptable to the individuals through their full participation and at a cost the community and the country can afford to maintain at each and every step of their development. The principles of primary healthcare are equitable distribution, community participation, intersectorial coordination, appropriate technology, and focus on prevention. First is equitable distribution. The health service must be shared equally by all the individual people, irrespective of their ability to pay, and all rich or poor, urban or rural, must have access to health service. Second is community participation. The involvement of individuals, families, and communities in the promotion of their own health and welfare is an essential ingredient of primary health care. In India, it has tried successfully using village health guides and trained DICE. They provide primary health care by overcoming cultural and communication barriers in ways that they are acceptable to the community. Next is intersectorial coordination. The Declaration of Alma-Ata states that primary healthcare involves, in the addition to the healthcare, all the related sectors and aspects of the national and community development, food, culture, industry, education, housing, public works, communication, and other sectors. Next is appropriate technology. Appropriate technology has been identified as technology that is scientifically sound and adaptable to the local needs. Focus on prevention. Health service should, however, not only be curative, but should also promote health and a healthy lifestyle with emphasis on prevention. So these are the 5 principles of primary health care. Now comes the concept of prevention. There are 3 concepts of prevention: primary prevention, secondary prevention, and tertiary prevention. First is primary prevention. The actions taken prior to the onset of the disease, which removes the possibility that a disease will ever occur. That is primary prevention. The intervention is in the pre-pathogenesis phase. It has two substages: health promotion and specific protection. Next is secondary prevention. Secondary prevention is the action which halts the progress of a disease at its incipient stage and prevents complications. The specific interventions are early diagnosis and adequate treatment. The third one is tertiary prevention. All measures available to reduce or limit impairment and disabilities, minimize suffering caused by existing departure from good health. That is tertiary prevention. It has the disability limitation and rehabilitation. And one more prevention is that is primordial prevention, which is before primary prevention, and it is the prevention for the development of risk factors. So it is the steps which we are taking to prevent the development of risk factors. Thank you. Rest we will continue in the next section. Thank you.